Why do I dribble after I pee? Have you ever finished peeing, zipped up your pants, and then noticed a few drops of urine in your underwear just minutes later? If so, you're definitely not alone. This is called post-void dribbling, and it's one of the most common urinary complaints I hear from men in my clinic. The good news? In many cases, it's completely harmless. But sometimes it can be a sign that something else is going on. In this video, I'll explain why it happens, when you should be concerned, and what you can do to reduce or even prevent it. First, what actually causes those last few drops? Many people assume the bladder is still full, but that's usually not the problem. Most often, a small amount of urine simply remains inside the urethra, the tube that carries urine out of your body. After you finish urinating, gravity or movement can cause those remaining drops to leak out. One thing I often tell my patients is that post-void dribbling is incredibly common, even in younger men. Many people immediately think something must be wrong, but in many cases, it's simply a normal amount of urine remaining in the urethra. Cause number 1, normal anatomy. This is actually the most common reason. Even healthy young men can occasionally notice a few drops after urinating. It doesn't automatically mean you have a disease. If it only happens occasionally and you have no pain, no blood in your urine, and your urinary stream is otherwise normal, there's usually no reason to worry. Cause number 2, weak pelvic floor muscles. The pelvic floor muscles help push the last few drops of urine out of the urethra. If these muscles become weaker, urine is more likely to remain behind. This becomes more common with age, but can also occur in younger men. Pelvic floor exercises can often improve symptoms significantly. Cause number 3, enlarged prostate. As men get older, the prostate commonly enlarges. This can partially block urine flow, making it more difficult to empty the urethra completely. Many men with an enlarged prostate notice a weaker urine stream, difficulty getting started getting up at night to pee, and post-void dribbling. One misconception I hear very often is that every man with post-void dribbling has an enlarged prostate. That's simply not true. In younger men especially, this symptom is usually caused by something much less serious. Cause number 4, urethral stricture. Sometimes the urethra becomes narrowed due to scar tissue. This is called a urethral stricture. Although much less common, it can lead to a weak urine stream, spraying of the urine incomplete, emptying and dribbling afterwards. If these symptoms develop gradually, it's worth seeing a urologist. Cause number 5, neurological conditions. Your bladder and pelvic floor depend on healthy nerves. Conditions affecting the nervous system can interfere with normal bladder emptying. Fortunately, this is a much less common cause. So what can you do? Fortunately, there are several simple things that often help. First, don't rush. Many men stand up immediately after the urine stream stops. Instead, wait another few seconds. Sometimes that's all it takes. Many men think shaking harder is the solution. In reality, simply taking a few extra seconds often works much better. Another helpful technique is called urethral milking. After you've finished urinating, gently press the area behind the scrotum and move your fingers forward toward the base of the penis. This helps push the last few drops of urine out of the urethra. It sounds simple, but many men notice a clear improvement. And yes, using a small piece of toilet paper afterwards is perfectly reasonable. Many of my patients already do this, and there's absolutely nothing wrong with it. When should you see a urologist? Although post-void dribbling is often harmless, you should make an appointment if you also notice blood in your urine pain, during urination, repeated urinary tract infections, difficulty emptying your bladder, or a progressively weaker urine stream. These symptoms deserve proper evaluation. One thing I always tell my patients is this: a few drops after urinating are usually not the problem. What matters is whether the symptom is changing, getting worse, or occurring together with other urinary symptoms. That's when it's worth getting checked. Conclusion: post-void dribbling is extremely common. For many men, it's simply a normal consequence of a small amount of urine remaining in the urethra. Simple measures like waiting a few extra seconds, using the urethral milking technique, or doing pelvic floor exercises can often make a big difference. But if your symptoms are getting worse or are associated with other urinary problems, don't ignore them. A simple evaluation by a urologist can usually identify the cause and help you find the right treatment. If you found this video helpful, consider subscribing for more evidence-based urology videos. Thanks for watching, and I'll see you in the next one.